Now, when things go wrong for an NHS patient, fatally wrong, we have a right to know the truth afterwards, don't we? Transparency is absolutely vital because that's how we learn. We learn from our mistakes. But a culture of covering up is leading to wholly avoidable deaths in the NHS, with hospitals failing to learn from their mistakes. And that is according to the Health Service Ombudsman, Rob Behrens. He claims that some people's medical records are actually being tampered with after they've died to cover up errors, and that clinicians have lost their careers because they've been brave enough to step forward and say, look, this has happened, and they've been sacked.
Someone who knows about this all too well, Tanya, whose baby boy, Ashton, was stillborn back in 2012. He was one of 45 babies who should have lived if they'd received adequate care, according to an inquiry into maternity and neonatal services at the East Kent Hospitals Trust, where she was being cared for. Tanya joins us now. Along with Rob Behrens, the Health Service Ombudsman, it is your last day. Good morning to you both. Rob, it's your last day as the Health Service Ombudsman for England, but you are going out with a bang. I mean, you basically say there is a massive culture of cover-up. People are too afraid to speak out. Medical records are being tampered with. You say that you're not a naive person, but after 7 years in the job, you're seeing far too much evidence of this.
Absolutely. I'm not saying it's universal across the NHS, but there are unacceptable instances of it. And one instance is too many and too much. And it's something that needs to be addressed. And I'm not just saying it at the end of my term. I've been saying it for the last 5 years, but not enough people have listened.
What kind of level is this cover-up initiated from? Is it a consultant? Is it a NHS civil servant? Where is this coming from?
Well, it depends on the circumstances, but it does happen at all levels. So when a trust makes a mistake, in my experience, too often, and we investigate, we're the independent investigators. We don't report to ministers, we report to Parliament. When a trust investigates, there is a tendency for it to be very defensive and to put its reputation above the need for patient safety. And when that happens, there is a pressure on people not to disclose at the clinical level, at the administrative level, what has really happened.
What are they frightened of? What are they frightened will happen to the trust, say, if the truth comes out?
Well, the NHS lives on its reputation for trust. We have seen in the last 24 hours a national survey which shows that only 24% of people have confidence in the way the NHS is currently run. And that means that a lot of people are not confident that they'll get good service. And the managers and the leaders of the trust have taken the wrong view too often, that if you keep quiet about it, it'll be OK. And so what has happened, unacceptably, in some very big cases, is that trust leaders have told people who want to disclose what has really happened in avoidable deaths. There are 11,000 avoidable deaths in the NHS every year. They've said, this is not acceptable for you to do that, and it's a disciplinary issue if you continue on that route. And a large number of doctors, good, honourable doctors, have been referred to the General Medical Council. Sometimes the GMC has not been told that there is a disclosure, a whistleblowing issue there. And this is no way to run a health service.
Tanya, absolutely shocking what happened to you at East Kent Hospitals Trust. You were overdue with your lovely baby. You knew there was a problem, didn't you? What was the response from midwives, the doctors, nurses?
I was really very unwell. I was desperate to be listened to, but everything was very dismissive. I was told I was over-exaggerating, overexcited, and I was turned away several times. I was even sent to the hospital when I lost all hope with the community midwives. I went to my GP, which is really unusual when you're already almost 2 weeks overdue. the GP wrote a letter saying you need to go to the hospital and have your baby delivered right now, today. And I even got sent home that day saying that there was no room for me, and there wasn't room the following day, and there wouldn't be room over the weekend, so I'd have to wait another 5 days.
What did you sense was wrong?
I was just very unwell. I was in a lot of pain. I was uncomfortable. I had sickness and diarrhea. I had really bad headaches. My GP hinted to me that she thought I had preeclampsia, which is
very dangerous.
I believe I had.
And what happened?
So I went away and I went into labour over the weekend. I presented at the hospital on the Sunday morning, the 4th of November. Only to be told again that I was exaggerating and that I didn't need to be examined. They could 100% guarantee I wasn't in labour, and I was sent home because I was booked the next day for my induction. So I did go home, but later that day I couldn't feel my baby moving anymore. So I went back to the hospital where they told me I was going to have to be brave because his heartbeat wasn't there anymore. And then I had 18 hours of active labour before a consultant came in and told me that unless they did a C-section, I was going to die. So I was whisked off and then delivered of my son.
And your son was stillborn?
He was stillborn, yeah.
And what were you told about what would have happened if the team had responded to your initial concern? What should have happened in your case?
So after the car cup investigation, I finally found myself being listened to, and they've totally agreed that if I had been admitted and taken care of from the first time that I presented, or even from when the GP suggested I be delivered, that Ashton would be perfectly healthy, there was nothing wrong with him. And, you know, all of this would have been entirely avoided.
It was the way that he was presenting, the way he was lying inside.
Yeah.
And the other, talking about a total failure of communication, even after this had happened and you were there and the operation was finishing, there were nurses coming in singing happy birthday.
Yeah, there was a lot of miscommunication during my delivery. So, you know, as I was there for 18 hours on the ward trying to get him out, but there were people coming in who hadn't been told that I was having a stillborn baby. It's a completely different mood. We were in that room crying and trying to say goodbye to our son, and people were coming in and almost saying, come on, get yourself together, you need to get a grip. And there was just a real lack of communication. And equally afterwards, I was so unwell, I had to stay on the ward for a couple of days. Obviously, without my baby, everyone else has theirs. You can hear them crying, and it was awful. It was the worst time of my entire life. And I had people saying, come on, get yourself together, you'll be okay, sit up, don't lay down all day long. There's no understanding really for the trauma that I've had to go through. And I think the endless fighting for answers, but constantly being pushed away, which is what so many people experience, it doesn't help you heal. You know, to this day, I suffer with PTSD, nightmares, and it really impacts on your whole life.
Mr. Behrens, it's difficult to think of an example of more multiple failings where lessons could and should have been learned.
Yeah. The key issue for the NHS is to learn from the mistakes that it's made. That's what a professional, compassionate body needs to do. And there's not enough of that going on. So Bill Kirkup, who has looked at maternity issues across the country, produced a report a couple of years ago saying that almost nothing had been learned from his time looking at maternity deaths in the northwest of England all that time ago. There are brilliant clinicians all over the NHS who are under great pressure, wonderful nurses, doctors, managers, but unless communication is better, unless people are told what is happening and don't feel intimidated in asking, this is a big problem. Complainants say to me, I didn't feel I could push it with the clinician. And sometimes these people are patronised in an unacceptable way to push them away.
Rob
that
Behrens,
has got to change.
What you're saying this morning is so important. People should absolutely feel empowered to push back, speak up, ask for a second opinion.
Indeed.
Ask for
Martha's
intervention.
Law.
Martha's Rule is coming in, of course. Tanya, thank you for sharing your experience. I'm just so sorry. It's
So
just
sorry.
absolutely horrific. You know, speechless about
It's very
what
brave
you've
of you to
been
come in
through.
and go through it in that detail.
Thank
you.
you.
An NHS spokesperson said it's absolutely vital that everyone working in the NHS feels they can speak up and that their concerns are acted on. They've brought in extra background checks to prevent directors involved in serious mismanagement from joining another NHS organisation. And when NHS staff raise concerns, it can be overseen by an independent, non-executive who can hold the organisation to account. That's the official reply.
We have a statement from the hospital as well involved in this one. Sarah Hayes for East Kent Hospitals has said, "Our thoughts are with Ms Lynham. We are truly sorry for the failings in our care, and we are working with families to continually improve." Okay.
Remember that all details, if you need support in any of those situations, on itv.com/helplines, because I know it affects a number of you. Thank you both very much indeed.